if you're a veterinarian doing dentistry, then you've probably noticed that buying equipment is not so simple and easy. It's a jungle out there. A lot of the stuff that you see online cannot be purchased in your country and so on. The purpose of this video is to show you what I use, what I think is great, and how you can find this list to make it easier for you to get those instruments. So I just logged into my course portal for my dental coaching program, and in here you see my toolbox. So this is my list. So I'll just go through some of the instruments. So first, I have my Periodontal oral diagnostics set, and this is what I use to probe and chart and make a clinical examination of the mouth. And I use a periodontal probe. I like the North Carolina version. It looks like this. And so it has some marks. It marks 1 millimeter increments. So the top of this wide black area here is 5 millimeters. So I think it's very useful. You can also get one, you can use it for cats, but there's also one with a tiny ball end that could be useful for cats, but I just tend to use this one. And in here you can see there's some links to click on where to get it. Then I use a Pigtail Explorer. So the Pigtail Explorer is very useful for finding little signs of tooth resorption in cats, and it has a tiny curved end here and is very sharp and thin. And if you click here, you can probably see on a website, yeah, here it is. You can get, I get mine from IM3, and it looks like this. So very curved and pointy and very sharp. So that's great. The next one is the mirror. So a mirror is used to look on the inside of teeth, but also to keep the tongue away when you are doing an oral examination. You can get whatever mirror that you can find. And if you feel that it fogs up, then you can use some anti-fog solution you can spray on it, or you can just keep it warm. You can dip it in some warm water before you use it. That also helps. Then you need a scaler. So this is a universal scaler, and they look kind of something like this. So they are used supragingivally. That means to remove calculus from the crowns, not in the pockets. The pockets you use a curette. So a universal curette is great. It cuts on both sides, but what is really useful is those LM Gracey mini curettes. And the LM curettes are, in my opinion, among the best, and especially because they have a very small end. And for dogs and cats, we need something very small so they can go into that pocket and clean out calculus and plaque from the pocket. So I use the 13-14 for the distal part in the mouth, so the most caudal, and the 11-12 for the rostral part. And they need to be called mini, so Gracey mini. And everything can be stored into a nice cassette. And I keep, so if you have, let's say you have 4 patients in a day, you need 4 identical sets. That's the most effective way, because then you don't have to spend time cleaning in between. You can just grab a new set, and that investment saves your nurses so much time, and also saves you from transmitting disease from one cat to another. This is not sterile procedures that we're doing, but especially with cats, we don't want to transmit disease from one patient to another. Then I have my extraction set, and I keep the extraction tools inside a metal box like this. You could argue that if you move it around and it gets shaken around in here, it dulls the tips a little bit of the Luxators, but you just got to be careful. It's not a big problem. This is what it typically looks like, a set. So I keep a couple of Luxators in there, and everything that you see on this list is inside my extraction set. A very good one is the Lagrange soft tissue scissor here, and this is curved, So it makes it very easy to trim that gingival edge after your extractions before you're closing it. And I do have some alternative links down here. If this link doesn't work in your country, you can try these alternative links to find that instrument. Then I have the periodontal elevator for cats. This is very good, very useful for releasing the flaps in cats. I like this one a lot because it's straight. So the tip here is straight and it's very small. Great for cats. So this is the periodontal elevator. Actually, they have a wrong link here. It's called D2005. D2005. So they must have changed the link. Here it is. Periodontal elevator fine for cats, D2005. That's the one that I recommend that you get. All right, let's go back to the list here. Okay, so the periodontal elevator for dogs. So you need a little bit larger one for dogs, and the one I like to use is from Medici. It's an Italian country. These are quite similar. You can get whatever you want. They are just a little bit bigger than the cat one. Okay, moving on to a needle holder. I really like to use the Olsen Heger needle holder, and this is because it can grab the suture and it can cut at the same time. Oh, there's a wrong link again. I need to go check this this list here, but you see here it is. So it grabs a hold of the needle and it cuts the suture. I like these. It doesn't work as well in very small patients, but for the most part this is quite useful instead of having to switch them around. Forceps, Adson 1x2. Forceps is the least traumatic one because it just, you see the tip, it just grabs onto the tissue in a very tiny spot. It doesn't crush the tissue, causing ischemia. So another thing that you can do is you can use a stay suture. So just put a stay suture through your flap and to keep it away. That means trauma only once. But this is a great forceps. Then I have a medicine bound round end tissue scissors, and this is great for releasing the periosteum before you are. So you're releasing tension in your flap. This one kind of finds its way between the mucosa and the periosteum because it's a round end. So it's a very nice medicine bound scissor. You need some curettes. Some round curettes that can scrape out the alveolus after you, wrong link here, let's see, something you can use to clean the alveolus from infected granulation tissue. I really need to do some cleanup on this this list right here, because these websites sometimes they will just change the links, whatever. But by the time you see this video and download this list, I'll have it fixed. Round scalpel holders is very useful because it's easier to maneuver around when you are using that scalpel. Things that I use for extractions but keep separate is the flexible nickel titanium periodontal. This is very good for deciduous teeth, extracting deciduous teeth. It's flexible, it follows the root, so this is what I use. And let's see here, some extraction forceps. What do you need? I keep some different kinds. This is just a regular type of extraction forceps that you find in every vet dental store. In addition to that, I really like this one because this one has a diamond coated grip here, so it doesn't slip as easily. And this one is a game changer, the canine extraction forceps. This one fits perfectly on canine teeth, and I wish I just found this lots of years ago because it would have saved me a lot of wrist pain. So it adapts perfectly to the tooth of a canine tooth, so you don't have to squeeze as hard, and you get a much better grip. So you have to feel it, and then you'll never want to live without it. Let's see, some sort of root tip forceps. When you have a tiny root tip in the elbows, you need to go and pick out. This is a scissor type of forceps from Accessia, but there are alternatives. So just some sort of, oh, they changed the link again. Oh my God. All right, well, some sort of root tip forceps is going to be very useful. The lip retractor for keeping the lip away looks like this. The purpose of this is to eliminate the need for your assistant. Okay, so you can use these to hold the lip away while you do extractions. This is very useful, I think. All right, let's have here scalpels. What do I use? I use a size 15 scalpel and a 15C. So this is what I use. In terms of Luxators, this is what I love to use apart from my stubby handle Luxators. I use these from IM3. They are almost indestructible, very sharp and very strong. But when I need something that needs to be almost like a scalpel, a strong scalpel, so thin that it cuts the periodontal ligaments easier, I go for the Dentanomic. And this will truly speed up your extractions without a doubt. The only downside is these tips, they get dull after maybe a month or two, depending on how you use them, how well you take care of them, and so you need to replace these. But they have a system in here where they can ship it to you regularly. But remember, don't use dull ones. If you use the sharp ones, your extractions will be so much easier and faster. You need also some bulky elevators. So these are when you really need something tough, like getting out a canine tooth to elevate it. I use something similar to this IM3 Ergo elevator set is perfect. Let's see here. Burrs. What kind of burrs am I using? So the 701L surgical length cross-cut tapered fissure burr. I use that for sectioning the teeth. I use it to remove bone. So I use that a lot. I don't use any round burrs with it to remove bone. You are perfectly okay using round burrs. It's not an issue at all. I just find it quicker because I can do the sectioning of the teeth and removing alveolar bone with just one burr. For cats, there is a smaller version, $6.99, which get the surgical length on if you can. It's better. Root tip burrs is perfect. I could not live without it. They are extra long, extra thin, and these are very great for digging out moats around root tips in the jaw. So these are, I could not do dentistry without these. They're very useful. Then I use a standard football diamond burr, just to medium grit, just to smooth down the bone after making the surgical extractions. Gingivectomy burrs, to, let's say you have some gingival enlargement you need to remove. I like to use these. They are originally called peri-implantitis burrs. So they are used to remove the metal threads in the implants, but they are extremely useful for cutting away gingival growths while stopping the bleeding. So they will cut and stop the bleeding. So they are very good for that. You can also use a ceramic tissue trimmer, which is when you use it, you put it in the high speed and you just turn water off. So it needs to run dry. But what it does, it cuts and it coagulates. I think it's not as super precise for contouring the surface because it tends to kind of dig into the tissue. But if you need to remove a small mass, this is better. This is perfect. Suture material, use monocryl. There are different brands and so on, but monocryl is what I use on a reverse cutting needle, P3 needle. 5/0 for small dogs and cats, and 4/0 for medium and large breed dogs. Then I use some needles for my local nerve blocks. The 27G hypodermic needle. 40 millimeters long, extremely useful. You'll see inside my nerve block course why switching to these needles will change the whole game of placing nerve blocks. They will become so easy and second nature so fast. So I'll show you inside my nerve block course. You can find that on my website, www.mortenvetdentist.com. You can find that course and see how you can place that nerve block very easily. I also use a 25G hypodermic needle, 16 millimeter long. It fits perfect for cats. I show you that inside the course. This is a little bit extra I put in here, dental units, what unit to get. So there's a whole range of units. And I think you have to think about what kind of work am I going to do. Is it going to be extractions only? Or are you also going to do endodontic restorations and more advanced surgical work? So the IM3 dental units are great. They can be upgraded and so on. If you need something human grade, if all you do is dentistry, I would look at something like the XO or the Pro X or the HEKA dental, HEKA dental. Something with a micromotor, electric micromotor, and if you can incorporate suction, have an external suction engine to remove saliva and water and so on from the mouth, shoots it straight into the drain. That is perfect. You don't need to empty any containers or anything. So this is what I have. Very great. Handpieces, high-speed turbine. Whatever you can find is great. Sometimes you can use this coupling to change it quicker. That's great. There's also some links in here on what to use. If you're doing restorations, low speed, 1-to-1 with water, blue ring, that's what you should get. This is perfect. It takes a special kind of burrs, so use that for restorative work where you need a little bit slower drilling. This is a speed increasing dental handpiece. It's a red ring, so it increases the speed 5 times. This goes onto your slow speed handle, and this handpiece goes on there. And if you set the slow speed to 40,000 rounds per minute, this increases it by 5. Then you have 200,000 rounds per minute, which means you essentially have a high speed. But the thing about this is the torque is amazing. You can just drill through the tooth like it's butter. You don't have to use that feather-like motion all the time like you do with the normal high-speed turbine handpiece. So this is much stronger. If you can get it on an electric speed increasing system, that's a little bit better and more precise than air driven. This is why I recommend finding human grade dental units, because they have electric micromotors, not air driven slow speed. After I started using this, I hardly ever use the turbine or the high speed anymore. I just use this one instead. You can buy one of these air motors. If you have a slow speed with water, you can buy an air motor. You can click that on to your slow speed. Of course, they changed it. You can click that on your slow speed cord and to be able to attach one of these handpieces. Now you have this system. Profi angles, there's lots of different handles that you can use for polishing. This one rotates slowly. You can also get one that is moving back and forth. It's pretty much preference what you like. And for X-ray, I recommend the CR7. It's really good. With phosphor plates, that's my favorite. If you have a digital system, that can be faster but can also be slower because the plate size is smaller and a little bit more bulky. You can also get a size 4 digital plate, so I would get one of both. If I had the finance to buy size 2 and 4 for the digital, I would get that, or I would just get the phosphor plate system. You need to sit well to sit upright, have good ergonomics. I really like the saddle chair from Sally. So Sally saddle chairs are some of my favorites. Looks something like this. You can find something similar. And this is really a game changer. So by getting this little ring here, I can adjust the height of the chair using my foot only. I don't have to take my hand under the seat, flick a switch, take the glove off every time I have to move my chair up and down. You can just use your foot. So this is extremely good to get these as an add-on. Something extra to get for ergonomics is dental loupes. So loupes is, if I didn't have dental loupes, I would not like doing dentistry at all. I would have to go to the chiropractor all the time. I would have back pain, neck pain. I wouldn't enjoy it. So this is an ergonomic aid. You have them made custom for you. So it's very important that you save up and you invest in something good, because if you get something good like these, you will have them for the next 10 years of your career. Whereas if you buy something that is universal, fits multiple people, it's typically lower quality, and you end up not liking them because they don't fit perfect to your eyes and your working length. So you end up not using them at all, which is not the purpose. So it's really important to invest in loupes like this. They typically cost a little bit, like between 2.5 to 4,000 euro for a good custom pair. If I didn't have the means to buy that right now, I would recommend getting something like this. These are fairly good. It's not perfect, but I would much rather work with these than nothing. So these are from Univet, sold by Accessia. You see they have 3 different sizes, pupil distance, and 3 different working lengths, or 4 working lengths. The working length is the distance from your eyes to the tooth you're looking at, right? My working length is 58 or 59 centimeters. So these would not be good enough for me because I would still have to hunch over to get close enough. So when I sit upright with my back, I need 59 centimeters of working length, and these are not good enough for that. I would have to hunch over, but it's still better than nothing for sure. But save up to get some good pairs. There's also different types you can check out in here. A dental table, very important to get a table that you can move up and down. Height adjustable table is really important. You don't have to buy the super expensive table. This is a fairly well priced, and this is a perfect environment to work at, because when the headrest is hanging over the table, that means you can place your knees under the head. You can work from the side, from the front, the other side. Is very important. If you have a consultation table like this and the head needs to be placed here, then you're going to be struggling with your legs hitting these and so on. So you need something that extends the table to place the head here, and if you can adjust it up and down, your ergonomics, your back and neck will thank you for sure. So a little bit extra stuff down here. I won't go through that. You can go and click the link in this description to register. Give me your email and name, and I'll send this list to you with the updates. Of course, I'll just go ahead and check it, so all the wrong links will get fixed. So go in the link in the description and click that. I'll send this to you. And by doing that, you'll also receive some further tips and tricks and videos like this from me in your inbox. So see you around until next time.